Are you a woman in midlife that has ever wondered, why won't my body let me stay asleep? Or why am I struggling to stay asleep all night? Or perhaps, why do I wake up after every 2, 3, or 4 hours of sleep? If so, then this video is for you. Hi, I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert, here to discuss several medical reasons why you have a hard time staying asleep. All right, ladies, so let's explore these medical factors that are keeping you from getting the restful night you need at night. First off, number one, and this is something that if you've seen any of my videos, I always love to talk about because it's so common, is, drumroll please, obstructive sleep apnea or OSA. This can happen really commonly, 1 in 5 adults, maybe 1 in 4, depending on your age or your body mass index. Signs and symptoms for this include loud snoring, gasping or choking, feeling tired when you wake up in the morning. But guess what? Women, and some of the research shows up to 40%, don't have some of these typical features. What do we have? Well, headaches in the morning, difficulty maintaining sleep, we report insomnia, mood disturbances, and then just feeling fatigued throughout the day. So if you think you may have obstructive sleep apnea, talk to your doctor about getting tested for this. Another medical reason that can keep you from staying asleep is chronic pain. Sometimes it can be really difficult to stay in the same position for too long. As we get older, our body is also aging, and with that comes aches and pains. If you're on your back for too long, you may need to turn to your side or even onto your stomach. And also, circling back to obstructive sleep apnea, sometimes people toss and turn because you're trying to get in a position where your airway opens. And so definitely obstructive sleep apnea, but also pain may be disrupting your sleep at night. Another one that I often like to talk about is waking up to urinate or nocturia. Nocturia, if it happens more than twice a night, we consider problematic. And guess what, ladies? As we get older, our muscles just aren't as strong. Maybe we've had a couple of kids, either through C-section or vaginal delivery, and that can affect our muscles of the pelvic floor. Also, we're told to drink a lot of water, and if we're drinking too much water, especially too late at night, that can cause us to wake up. Also, as we go through the hormonal change, perimenopause is menopause, we become lighter sleeper. And if you're a lighter sleeper, you're more prone to feel that sensation that your bladder's full, to wake up and urinate. So if you're waking up to have to pee at night, I totally get it, but talk to your doctor to see if there's any underlying things that you can do. Maybe see a urologist, maybe try medications to help improve this, or maybe get, again, tested for obstructive sleep apnea. Speaking of hormones, let's talk more about what happens when we lose estrogen and progesterone. Well, progesterone is a really important hormone to help us feel calm and help us sleep better. And as that level lowers, we have more light sleep and we can have problems with insomnia. Another thing is when we have lower levels of estrogen, guess what? That leads to hot flashes at night. And sometimes you may not even wake up in a sweat, having to change your clothes, but sometimes your body temperature just rises, and that can keep you from sleeping. Acid reflux or heartburn can really be uncomfortable. So if you have a hard time staying asleep because maybe you feel this acid sensation and need to burp a lot, consider the foods that you're eating or even your body position. Try to sleep more upwards in a wedge pillow or get an adjustable bed, as that can help. Also, things that can play a role with your sleep quality, you're having a hard time staying asleep, are your mental health. So anxiety and depression. In medical school, we were taught that early morning awakenings in the morning were associated with depression. So please, again, talk to your physician, your PA, your nurse practitioner, and see if you could benefit from medications to help treat your mental health conditions, or even therapy, or even supplements. There's a lot of treatments out there, ladies, and I hope that you get the answers you need. At the end of the day, regardless of what's keeping you from staying asleep, if you may not know, I always encourage folks to journal it down, do sort of a symptom audit. Try to be your own detective, as it could be more than one medical issue that's actually keeping you up at night. I hope you found this video helpful to learn more about women's sleep health and whole living. Please subscribe to our newsletter, the Sleephoria Insider. Link is below. Until next time, ladies, sleep well.